morning, my name is Jessica Martin. I'm a student at Williston College, and I will be performing my IV skills today. So first, I'm going to look at my doctor's orders, front and back. So I have orders to insert an IV catheter for 11:45 and infuse 150 mils an hour of lactated ringers. So I'm going to go to my patient's room. Good morning, Shirley. My name is Jessica. I'll be your student nurse today. Can you please confirm your name and date of birth? It does. Can you tell me any allergies you might have? Perfect. For privacy and hand hygiene. Okay, Shirley. So today the doctor's ordered that you have a catheter inserted. Have you ever had that before? You have. Okay, perfect. So you're kind of familiar, but a little bit of a sting, but it won't last very long. And you're a little, kind of know how it goes. Perfect. Do you have any questions for me? Okay. So you're just going to be having some lactated ringers to help with a little bit of dehydration. So I'm going to go get all my equipment, and then I'll come back and we'll get you started. So I'm going to go to my bedroom, and so we would have a brand new bag. I would take the packaging off, and I would check the expiration date. I would look at the coloration, see if there's any particles in there. I'd squeeze it a little bit, see if there's any leaking. Nothing is leaking. And I'm going to compare this to my 6 medication rights, medications for MAR. Everything is correct. So then what I would do is I would take out my tubing, inspect my tubing, check the expiration, tubing is fine, and I would take the cap off of here, and I'd take the cap off of the spike, and I would spike my bag. So after that is done, before I turned it over, I would close my tubing. And so then I'm going to get any air out of the lines. So what I'm going to do is flush my tubing. Okay, look, and there are no air bubbles. So I put the cap back on here, and I wouldn't have touched this to anything. And I'm going to hang this here. And again, the cap is back on it. Okay. So then I collect the rest of my supplies, and I will go back into Shirley's room. Knock, knock. Shirley, hello, it's me again. Just going to full privacy, head hygiene. I've got all of our stuff ready to go. Alright, so I am just going to get my supplies open and do my second med check. Okay, the 6 rights. I check everything that is correct. Again, Shirley Post, name, date of birth, and allergy decoding. Okay. I would also slap a label on the bag and the label on the IV, the tubing, so the nurse knows when it was last changed. Next nurse who comes on shift. So now I'm just going to find a good vein for us to use. Okay, Shirley, put there a tourniquet on your arm here. Just a little bit of a squeeze, but not for too long. There we go. Alright, so I'm going to look for a vein that is not boggy nor solid. And I think right here I found a good vein that will work. I'm just going to palpate that. Okay. And open this. There's my cleaner. And I'm going to move in the middle in a circular outward from the vein from the side that I'm going to be doing this. Okay. While that dries, I'm just going to get my supplies ready. Oh my God. This is not a sterile procedure, so I do not need sterile gloves. I would write my name and the gauge of the needle and the date. This is going to go on the dressing. Check the expiration date for my saline. This is good. Just going to be getting ready for my saline lock. Okay, so I'm not touching the end of the cap to anything. Close this for a minute. Oops. Okay, I'm just going to flush the air out of this. And there are no air bubbles in my line. I'm going to put this back in here. Okay. Okay, Shirley, we're just going to get the tourniquet back on. Your site is dry. And I'm going to get my gloves on. Okay, so I see my vein. Going to take this, loosen the hub a little bit. Going to go bevel up. Going to anchor the vein. And my shield is fogging up a little bit. Going to anchor it. Go in. I just get a little flash of blood, so I'm going to keep going. Shirley, if it's getting painful or you need me to stop, just let me know. I need to advance it. Okay, now I'm going to activate my safety. Okay, I got the tourniquet. There. And I'm going to flush it to make sure it is patent. Shirley, are you having any pain when I do that? No. And are you, and I'm looking for any bubbling up, any pale blanching spots, things like that, and I see none. I'm going to close that. This right here. Okay. I'm going to put our occlusive dressing on now. And then I would put our label on it right here. And hook up the tubing. Take off the cap. This cap is clean and then kept sterile. This is closed. There are no air bubbles. The vein is patent. We've already checked it. Now I'm going to hook up our IV lactated ringers. Open this and set the infusion rate. Then I will put this into the sharps, clean up my area, and go. All right, Shirley, how are you feeling? Is there any pain? No? Okay. And so now we'll go document according to facility policy. I'll document the site, document how many attempts there was, document the gauge of the needle, and all other things according to facility policy. What I'm infusing, the infusion rate, and if I needed to make it go faster, I'd go higher, and if it needs slow it down, I'd go a little lower. And when I initially hung this, what I would have done was squeeze this about till it's halfway full. Just forgot to mention it earlier. So now we are just going to be changing this to a saline lock. Later on, the doctor was asking us to do that with an order. So, knock knock, Shirley. Hello, it's Jessica again. Can I get your name and date of birth? Shirley Toast. She tells me name and date of birth. And codeine is her allergy. Thank you for confirming that. Okay, so we're just going to be changing this to a saline lock. And when I would have started the infusion, I would have opened the valve. So now we're just closing the valve, and we are getting our saline ready. We're going to close this. Take that off. I'm putting this on. Now we're going to just flush the vein again. This would have been a new thing of saline. So we're flushing it. Get any medications in there, get them out, and clear the line. There we go. Like that. And then we're just going to take this over here. So now it's a different day. The doctor has discontinued the IV. So I'm looking at my orders, and I'm going to go and do this. So hello Shirley, how are we doing today? Heard you're going home. So can I get your name and date of birth, please? Okay, thank you. Shirley Coast, 4387. Can you confirm your allergy? Thank you. She confirms her allergy. So I'm just going to get my stuff ready. And throughout the process, I would have taken off and donned new gloves as different things change. Not a big deal. Okay. So Shirley, we're getting your IV out. Now let's just start to take some of this off. I'm going to start by off the edges here. Okay. Going to hold the gauze over here while they take the catheter out, keeping it straight. Put pressure and inspect the tip, make sure the tip is intact. This goes into the sharps, and I tape this, hold for 30 seconds, and that would stay. And Shirley, can you hold that for 30 seconds for me? Thank you, wonderful job. Okay, so now after 30 seconds, I'm going to, I'm going to check it, assess the site. I'm looking at the site, I'm going to chart everything that I see, any abnormalities, and I'm asking her, are you in pain? She is not in pain. Then I'm going to get her a clean piece of gauze and put it on there, and then I will go back and make sure she has a collate. Beds down low and locked. I remove the privacy, and I go chart everything I need to chart for the IV removal, when it was done, any abnormal findings, and yeah, skills complete. Can't see.